although pretty much everybody here is familiar with it. But of course, Right Care Alliance is a grassroots coalition of clinicians and patients and community members organizing to make healthcare institutions accountable to their communities and put patients, not profits, at the heart of all healthcare. So tonight we've got several guests, and as I struggle to pull up my email here, and I'll introduce in the order that I have them here our speakers. Our first speaker tonight is Catherine Shermoff of the United Methodist who is a United Methodist pastor and also a type 1 diabetic. So if you'd like to start, please.
Good evening. Thank you so much for inviting me to come and speak. I cannot tell you how much I have enjoyed listening to the webcast and being part of your group. My world was rocked. Seriously rocked on March 30th, 1970. I was just a little kid and I woke up in the hospital with blood sugar over 1400. And there was a lot to worry about. But what was I worried about? I was worried about fitting in. I didn't want to have a shot. I didn't want to do this. I didn't want to have to eat pickles instead of ice cream cones. The diabetes management back then was way different than it is today. The one thing I never worried about was whether we had enough money to go to the doctor or to buy the insulin that I needed to stay alive. Through the years, even through college and through graduate school, poor college student, again, I would go to Walgreens, I would get my insulin, and I never had the fear that I have today. Through the years, my husband, who has passed on, had very good insurance, and we had 3 beautiful children. I never had the issue of being able to afford the insulin because I had good insurance, but even without insurance, the insulin never cost what it does today. Forward ahead again now, here 50 years later, I am a single person. I work for the United Methodist Church. In Florida, the United Methodist Church gave up our health insurance and stopped providing health insurance for clergy and church staff when Obamacare came into play, because they said it was no longer needed. The rest of the country, the United Methodist Conference does provide insurance, but the state of Florida decided to drop it. And I had my first introduction to Obamacare. And what I found was I had a plan that had such a huge deductible that I had to pay full price for my insulin. And what a shock it was when I went to pick up my insulin and I was told it was going to be $6,732. There was no way. I already paid a good chunk of money for that policy. And because I had this huge deductible, and everybody kept saying to me, but it's going to be okay, because you see, you only have to pay a couple months and then you'll get free insulin the rest of the year. Well, how do you do that? How does somebody have that kind of money there? Well, that year, what I did was I ended up having to go on basically black market websites, bartering for insulin. I've worn an insulin pump for many years, and it gives me great control, but I couldn't get my pump supplies. So again, here I go, black market, trying to get what I need to stay alive. And I ended up not only using a website on Facebook, which was probably a disastrously dangerous thing to do, but I knew without the insulin that I would die. And then I ended up going to my sister who lives in Canada and sent her money, and she went and got my insulin, because the same bottle of insulin that cost $561 in the United States cost $28 in Canada. So she got the insulin and she packed it up. Everything was great. I was really so thankful. And the United States Border Control seized it. They sent it back to her and they said, no way, we are not letting this in. Why not? Well, because if we let drugs come into the country, then we're not making the profit. And that was about it. So since then, I got a better Obamacare policy. It now costs me $1,699 a month. But because I am poor, I get a $1,300 a month subsidy. So I pay $400 a month out of pocket for my policy, and then I pay for my insulin. Now, They no longer cover Apidra, which was the insulin that was the best insulin I ever took. It worked like a charm. It kept my blood sugar. My A1C was 5.1. Now they want me to take Novolog. Okay. Well, you know what? Novolog was $4,750, or it was $4,750 for 9 vials for the last 3 months. Or I could get it for $50 with insurance. Great. This is awesome. However, now they have said no more Novolog. You can have it. We're not saying we're not going to give it to you, but you have to pay now $4,750 copay because we are going to give you the generic. Now I've taken the generic for a couple days. My blood sugar right now is 140. That's not really where I want it to be because that is not gonna, it's not gonna maintain my health is good. And for being a diabetic for 50 years, I'm doing great. I got 3 children, I got 2 grandchildren. I am full-time employed, I'm a pastor, I work hard, and I am a good contributor to society. If they dump Obamacare, there are going to be people like me who are good contributors, who have good productive lives, and our lives will be lost because we will no longer be able to get the health care that we need. We will not have access to, I mean, it's ludicrous to think anybody could pay $4,750 a month, or for 3 months even. So that's still almost $2,000 a month. That when you're thinking about how do you do that, I mean, that's over twice what my house payment is, my mortgage payment. And so I see more than ever that this is so important. Last night, Trump got called out by a woman who asked the same thing. You dumped the Affordable Care Act. What are you going to do to protect me who can't get insurance? And he didn't answer. He has no plan. It's almost, I feel like he has almost made us an expendable part of the population. Those who are older, those who have chronic illnesses, we have been deemed unproductive. And that is the furthest thing from the truth. Now, I don't know, I mean, I don't know how to get the people out to vote, but I have never recognized more in my life how important that vote is and how important it is. When I listened to Biden today, listening to him talk, he's got a plan. He's got things in place. He is looking to protect where the other candidate is looking to destroy. And so as I sit here, I'm nervous. I'm really nervous because if Trump gets back in, what's going to be my quality of life? I've worked really hard for 50 years to stay healthy, and I am scared. So I don't know what else to say other than this has been, I've watched our insurance system degrade, but I've also seen the Obamacare come in and cover the pre-existing condition when my own employer stopped it. If that is stopped, do you think anyone will ever insure me again? I don't. So that's bad and the ugly.
Yeah, and that's a perfect segue for Jeff, our medical students. You know, physicians are very concerned about your plight. We deeply understand this problem. And we know that if we write prescriptions and you can't afford them, then we are not providing care. Mm-hmm. So this is a central issue for every single physician. So Jeff, do you want to introduce our 2 fourth-year medical students who are going to talk about what they're trying to do to help?
All right. And so our 2 fourth-year medical students for Vote Health are Yumiko Nakamura and Cynthia Guerra. And I'll let you take it away.
Hi, everyone. Thank you so much for having us. My name is Yumiko, as Mr. Santeri said. I wanted to just thank Mrs. Furma for sharing that story. And, you know, I'm really sorry that you had to go through that. I'm here with Cynthia. Who can introduce herself. All right. I'm just going to share my screen. Can everyone see this? All right. So Vote Health 2020 is this national nonpartisan group of health professionals and students who are dedicated to getting their peers and colleagues and patients to vote this year. And we've basically just been going around talking to folks, answering the question why they should care about voting and why we even care about voting as med students.
So voting and health are connected. Voting is how we choose leaders, and it's how we choose policies that then dictate funding for hospitals and clinics. And it's even how Medicare and Medicaid are how they're decided to run and how much funding they get for each institution and for each state.
A lot of people think that this is maybe something relevant on the national level, or they have trouble relating to how this affects their everyday life. So, we wanted to mention some ways this has affected Alachua County. We know that rural clinic funding has been cut and cut and cut. And unfortunately, in the last year, Acorn Medical Clinic had to close its doors. We also know that we live in a state that didn't expand Medicaid. And in doing so, hospitals like Shands lost money, but obviously much more importantly, a lot of patients, they not only lost out on the possibility of having Medicaid coverage, but they are now without subsidies on the Obamacare marketplace. Like Ms. Fromoff was saying, without any sort of subsidy or tax break associated with the plans on Obamacare, it can be really unaffordable. And so you have all of these people who fell into this gap of not qualifying for Medicaid because we didn't expand Medicaid, but also not having any subsidized care.
So voting is a social determinant of health. And basically what this means is that not everyone is represented in our electorate. Voters, people who actually go out and vote, tend to be whiter, wealthier, more educated, and even healthier than the general population. And so, like I said, voting is a social determinant of health, and a social determinant is like a force or a factor that has an indirect impact on your health. So not being able to vote then can make you less healthy. So decades of research show that the least healthy communities are also the least likely to vote. And this kind of can create a more vicious cycle where health policies disproportionately impact some communities, leading to health inequities, and then that prevents those same communities from showing up to the ballot box and voting on leaders that will then create more policies that affect them.
The next reason we care is because there are all of these unfair voting barriers, or what people call inequities. We know, as with other social determinants of health, like housing or access to foods or physical activity, there's lots of barriers that make it really hard for our patients to take control of their health or be civically engaged, like limited transportation or language barriers. And another systems problem is that 1 in 8 voter registrations in America contains a serious error. And by serious error, we mean it can be something as small as forgetting to update your address when you move. And that has serious consequences. If all those people turn out to the ballot box, that means 1 in 8 of their votes could potentially not count.
All right, so in case you somehow missed it, we're in the middle of a pandemic, and a lot of people are really worried that if they turn up to the polls, that it'll be detrimental to their health, that they could get sick or that they can make someone else sick. And people are also really worried that their vote won't count this year. If they do a mail-in ballot, it won't get there in time or something will get messed up. So it makes it really important this year that we need not just convenient ways to vote, but also safe and secure ways to vote.
So Vote Health 2020 was really envisioned as this opportunity to address these problems. So it aims at spreading the word, making sure that our peers and our patients are voting. It tries to work with local agencies in the community to make sure there are safe voting plans in place. And then the big picture is really more about becoming responsible community stakeholders. So it signals that health centers and health professionals are part of the community. I think it signals that we are willing to invest in communities. And initiatives like this can get attention because it is strange to maybe see some medical students or health professionals being at the forefront of getting out the vote. But the truth is that there are lots of, like Mr. Pichet, who's with us tonight. Lots of great organizations and people in the community that have been working on this and other health-related issues for far longer than we have done a much better job. And it's really about just being able to join that table and say that we're part of this community and we want to talk about health issues and help tackle them. All right, so for people who say that you still don't have time to register to vote, we challenge everyone literally right now, you can whip out your phone, and if you open up your camera app and point the camera at one of these QR codes, whichever one is most relevant to you, it will take you to a website where you can verify your registration, register, update your registration, or request a mail-in ballot. You don't need a special app. That's something, a misconception we've heard. If you have an iPhone, it's basically geared up to just, if you point the camera, it'll take you to a website. Remind everyone that the deadline to register is October 5th. And there's a website for healthy voting tips at healthyvoting.org/Florida. And we'll pull this up at the end as well.
So one thing that we would love is both individual and community collaborators. We have a ton of no cost, contact-free resources, things like flyers, slides, business cards, presentation slides, email templates, stickers, all of that stuff we have, and we are really happy to give to you. Again, at no cost, it's all contact-free. So if you have any groups that you are a part of, or if you're going to give a presentation in the near future for some other organization and you want to use these slides or anything, you have the chance to spread the message, and we would love to help you do it.
All of our tools are, like Cynthia was saying, contact-free, so they're very convenient. They're set up in a way where, if you happen to be giving a presentation, you can pull up a slide. If you work in an office, you can put up some flyers. We have business cards you can keep in your wallet. It's really about spreading the message and making sure people have a really convenient way to sign up to register or to request a mail-in ballot. And so if you're interested, or someone that might be interested in our resources, and we have them all like printed out, stacked up in my apartment, or digital, you can email me, so yumiko@votehealth2020.com. And that's it. So thank you so much for listening, and we'll send this out to everyone so they have it.
Thank you very much. And it does work. I just tried it while we were on, and I was able to verify that I was registered in probably 20 seconds. So thank you for what you do, and thank you for putting that together for us. It looks like next we've got TJ. He's a Director of Communications and Outreach at the Alachua County Supervisor of Elections. So take it away, please, TJ. And I didn't say your last name because I don't want to butcher it. I apologize.
That's all right. It's TJ Pache, so it kind of rhymes. It helps a little bit. Not much. Nobody's ever gotten it right, but it's okay. I'm TJ. I'm the Director of Communications and Outreach at the local elections office. We're 48 days away from November 3rd, 2020, and I know I'm very much looking forward to 49 days away from today, because that would mean we're past November 3rd. You go to a polling place or to an early voting site in the next few months, what you see is going to be a lot different than what you saw in previous years. We have physical distancing procedures in place. We have tons of hand sanitizer. All of the folks who are working are required to wear masks. We have masks for any voters who do not bring a mask. And then the other big change in terms of the administration of the election is the huge increase in vote by mail. So during the 2020 primary in August, it was the first election in Alachua County where vote by mail comprised the majority of ballots. About 55% of voters during the 2020 primary here in Alachua County chose vote by mail as their voting option. Some counties have a higher rate. I know Hillsborough County, down where Tampa is, got closer to 80% vote by mail. Places like Pinellas that have long had strong vote by mail users got really close to that number as well. But given where we are in Alachua County with a population that is considerably younger in many cases than those other counties, and among the younger population, vote by mail is not a popular option. We're doing really well here, and we'll have even more vote by mail requests and vote by mail ballots returned for the general election. One of the questions I often get, I think I've answered it probably 3 times today, is just about the process for vote by mail ballots. So every single vote by mail ballot is processed. Every single vote by mail ballot is looked at. We don't just look at those if the election is close. We don't just look at those if we choose to. There's a uniform procedure statewide that all of these ballots go through in each of their individual counties that involves verifying the signature that is on the return envelope for the ballot, processing that ballot in person during a public meeting, and having the ballot actually counted during that same public meeting or set of public meetings. So it's really something, especially with Zoom and where we put the different meetings now, that you can engage with in ways that you previously couldn't, even though they've always been done in public meetings. One of the questions, it's more a philosophical question. If a meeting is public, but no member of the public actually shows up to it, is it really a public meeting? So we do encourage people to participate in those and to kind of play a part in that. But we're really looking forward to November 3rd. We're really looking forward to November 4th. And we're pretty confident in the different procedures that we've put in place. But really the best thing that voters can do to help us at this point is to sign up to vote by mail, because every voter who votes by mail is one fewer person going to a polling place or going to an early voting site. And that makes the social distancing or physical distancing and sanitation procedures a lot easier. I see a question in the chat. When do you think we'll have an estimate of the winner in Alachua County? We'll know probably 99.9% of the ballots on election night. And that's really going to be the case statewide. So if it's really, really close, then you may not have a clear view of who won Florida. But if it's within a certain distance, if the candidates are within a certain distance of one another, then you'll have an understanding of who won Florida on election night. And I got another question in the chat. So it's a question about the fear of ballots getting lost in the mail or not arriving on time. I will say that we tell folks, put it in the mail at least a week prior to election day to avoid any issues, and then keep track of the status on our website. So 3 or 4 days later, begin looking at our website to make sure that it was received. If you don't want to use the mail, we have drop boxes. The drop box at our office is 24 hours and will remain open until 7 p.m. on election day. And then there are drop boxes at every early voting site that are available during early voting hours. Another question. What early voting will be like is, again, we're going to have those social distancing or physical distancing procedures in place, but the number of sites remains the same, and the availability remains the same compared to past elections. We do encounter problems with signatures in a pretty limited number of instances. So basically the number that it works out to, in roughly 0.5% of cases for vote by mail ballots, we have signature issues. And those are divided into issues with the signature matching the one in the voter's record, or folks just not putting a signature on their ballot at all. In most cases, those issues are rectified before the deadline to do so. But the biggest issue compared to those is folks not getting their ballots in on time. So we're going to be doing a lot of messaging around the fact that they are due in our office on election day at 7 p.m. If you put it in the mail the day before election day, you can't reasonably expect for it to come to us in time. I got another question in the chat. If you choose to, yes, if you're going to drop your mail ballot off at a polling or at an early voting site or at an elections office, it does need to be in your own county. If you put your Marion County ballot in our drop box, then we would move it to the mail so that it could go to Marion County. Do you expect to have monitors or problems? you know, we have poll watchers during every election, and that's provided by statute and allowed by statute. I don't think we have any expectation of folks being you know, an issue, and a lot of that is administered at the local level, and we have positive relationships with both parties. But if anybody tries to affect somebody else's ability to vote, or, you know, honorously put someone's right to vote in question without any type of evidence, then they are committing a crime. And those are the types of things that we become very aware of very quickly. So the next question I have is, do we have enough poll watchers? So we don't administer poll watchers. We administer poll workers or election workers. And we're really lucky that we have about 2 or 3 times as many of those as we need. So that answers the next question. We do not, at this point, need election workers for November, given how many folks have applied in the last few months, which I hope everybody agrees, I think is a really heartening thing and speaks to the level of community that we have. All right, any more questions? I don't think so. That's my spiel. And if I'm gonna put my cell phone and my email in the chat, so if anybody needs anything, then you can give me a call. I always put my cell phone. Nobody ever calls me though.
We're respecting you.
There you go. I really don't mind. They pay me the same no matter what, whether I'm talking to you or twiddling my thumbs.
What do you expect the relationship to be between the Democratic and the Republican turnout in our county this year?
So that's really not something that we pay a whole lot of attention to. You know, we are pretty religious in being the, you know, apolitical, nonpartisan administrators of the election in this county, and to the credit of really every other elections office in the state of Florida, they are as well. So, you know, when folks mention, you know, X county has a better elections office, or I'm not worried because I live in X county or Y county, I always push back on that, because, you know, the folks who are doing what we do are not doing it for the money, and really do care about the process.
Do you have on the top of your head how the turnout was the last time we had a presidential election?
It was close to 80% of the voters. It'll be it'll probably be higher in 2020. I think in 2008, which, as everybody knows, was a very historic election year, we were over 80% turnout.
Great talk.
And do you see, are there certain areas of the city where turnout is lower?
Yes, historically and tragically, African-American men, both in voter registration and voter turnout, are always the most underrepresented in population group. And I think there's a lot of contributing factors to that, you know, some of which go back to, you know, the founding of this country, and some of which are tied to felons' voting rights, and the fact that African-American men, again, tragically, are more likely to be convicted of felonies. And I think that, you know, those types of things, wherever the processes that come out of the Supreme Court leave Florida, those types of things as a community and as a state will spend a lot of, it's going to be many years before we're at a place where we can reasonably say that folks have gotten a fair shake when it comes to having a voice in election. And I think that that's something that, you know, we have to continue to reckon with and continue to live with, but continue to try to do better.
Sharon, do you have any ideas?
Yeah, well, I just wanted to respond to something TJ said a few moments ago. I just want to be sure that when we talk about African-American men and felonies, that the term you used, convicted, is underscored because they are both charged and convicted, and often erroneously, or for charges that their white counterparts would not be convicted of. And this plays into the unfortunate narrative with respect to not having their voting rights restored. I would not want anyone hearing this to think that that we've got an epidemic of Black men committing felonies, and that is why that they are not voting. That's that underlying, that conversation is the racist policies against which we are pushing now in new and different ways. And it's one of the reasons why in 2013, when the Supreme Court made their decision that significantly watered down the protections in the 1965 Voting Rights Act, it was a tragedy about which the likes of the late John Lewis and others spoke so stridently, because they knew that right after that decision, the floodgates would open in places like North Carolina and a host of other places, to try to redistrict communities and so forth, so that they would diminish the vote or the effectiveness and close polling locations in communities where there were higher percentages of African Americans living, which included Black men. So there's not one reason. You said there's a host, but it's important to me that we hear that. I'm a former prison chaplain, and I will, just say that the story we hear, unfortunately, is sometimes the only story we hear, but it is not reflective of the full story.
Right. Yeah, I hope that nobody, in me saying what I said, understood or misunderstood me to think that I think that there's nothing but unfairness tied to many of these systems and many of these policies. One of the things that we do, and has been really eye-opening for me, is going to the Alachua County Jail and doing voter registration there. And I find it personally heartbreaking and professionally heartbreaking that, when we were able to do outreach within the community, if I did outreach in a white community, I may talk to 100 people who never had the issue of, confronting these types of systems. But if I talk in East Gainesville, 1 in every 3 or 4 people would mention something like that. And I think that it's not a good thing. And it's something that we'll have to reckon with for decades longer, centuries longer, or forever, really.
I would ask the question, TJ, do you find as you move about the community that maybe in ways that are not exactly the same, although there are some strong similarities, that there are people who do not want to register because they already feel as though they have a precipitating circumstance? So maybe they have 5 parking tickets, or maybe they have an open warrant, and they think, if I register to vote, I'm basically inviting legal trouble for myself. Better to kind of move under the radar. Do you ever hear people specifically state that as a reason?
Nothing of that sort, but increasingly, especially with the passage of Amendment 4, I know that much has been done to lessen the impact of Amendment 4, but at its core, there are still very many people to whom it applies and for whom, they would derive benefits, being able to register to vote being the chief one. And there's a lot of folks who don't have an understanding of what the current system is. But as I often say, these may be people who, for the last 30, 40 years of their lives have lived with this scarlet letter. And they haven't had any reason to pay attention. They haven't had any benefit to paying attention, because every time they've tried to, they've been, hit with, yet another slap in the face of not being able to do so. So I think that community education piece in breaking through that idea of, what do I care? I can't play a part in that anyway is a really important thing that, again, will take years to kind of break through.
All right. Well, of course, we know that the amendment for appeal was just dealt a cruel blow the other day. And so people are watching Florida to the extent that I hear from colleagues who do not live in Florida. I mean, right after that decision came down, within the hour, a colleague from, well, the General Board of Church and Society, Dr. Southwick and Allie, who just, sent me an email to express sympathies because they have heard so much about the work that some of us were, championing here in Florida for Amendment 4. And now 2 years later, because we passed it in 2018, this is where we find ourselves. And of course, timing is everything. And so, not a coincidence that this has occurred right before the presidential election, and probably for many people with too little time to make restitution or any kind of arrangement that would allow them to register to vote.
I'm wondering if Bloomberg is supposed to be giving $100 million to help in Florida, whether some of that money couldn't go to pay
Bloomberg,
this poll tax. It's a poll tax.
Yeah, it is. It is.
And I don't know, is there any way to reach out to Bloomberg?
That's a great idea. There is a way for us to do that, isn't it, Allie?
And I will say, folks, that there are processes that exist for restoration that don't involve people paying off their fees and fines. The public defender, or one of the assistant public defenders in Alachua County, just recently filed, I think, the first motion locally to, make it so that the person didn't need to pay those in order to have their right to vote restored. And I can't speak too much to it, but I don't know what the actual process looks like. But I will say that, one of the issues that I know we're running into, just anecdotally, is, people who have the ability to register, they've paid off their fees and fines. They've been done with, that aspect of whatever they did for 30 plus years, but still don't have the information about getting registered, or and I think that might end up being a bigger issue in terms of the number of affected voters, sadly.
Karen, is there anything we can do about that?
Am I on mute?
No, I can hear you. Go ahead.
Go ahead.
Okay, this is Leilani Doty. Fred, are you talking about Mike Bloomberg?
Yeah.
Okay, so if you all come up with something and want to address Mike, I actually went to high school with Mike, and our class president is really close, still close to Mike, although our class president isn't doing anything political these days. Well, I guess Mike is not either. If you all come up with something that you would like to propose to Mike, I would be happy to.
Oh, wow, that'd be great.
See if I can.
Sharon, could you probably know the most about this. Is there something you could come up with for this?
You know what? I think we probably could come up with something, because in the conference, we actually have among our anti-racism teams, a couple of teams that are specifically focusing on voting. You remember Juana Jordan, who was on our last call. And so yes. I think we should work to try to come up with something. How about that? And Leilani, I appreciate the offer. Do I know how to contact you?
Contact for me?
Mm-hmm.
Can you put it in the chat? Just put
that would be great.
I'll put it in the chat, or send it to you, Mike, Fred.
Okay, well, I have Sharon's email.
Yes, I was
Yeah,
going to say all roads lead to Dr. Southwick, so that would be
Yes,
fine.
right,
Yep.
right. I'll send it to him and
Yeah.
then my contact information, and you can get it that way. But I would be
Perfect.
happy to help, and I know Rick, our president, who's a retired minister, I could
Imagine that.
encourage Rick to be helpful.
Pastor Rick, encourage him to be helpful. I don't even know him. He's a colleague already.
Yeah, how can we reach East Gainesville? I mean, you know, as someone who's white, I'm not going to have a lot of traction there. But there are people there that are active in East Gainesville that we could help in some way?
I was just going to say, I know we have a couple of predominantly Black and brown churches in East Gainesville who have really strong kind of progressive pastors. I'm thinking Mary Mitchell of the sorts that would maybe like, you know, do some type of voting registration on Sunday. I don't know, something like that. But I just wonder, I mean, my shtick is always like, I think we can use religious organizations if we pitch it correctly. And I think that's a really easy way to get those communities involved. So I'd be happy to be able to get on with that.
How can we get Michael Bloomberg to be involved in this group and talk to us?
I think we're a little too small, small fries for Michael.
Alachua County, he needs to know about us with a little blue spot.
Yeah. But Allie, that would be great if you can get you know, start on that and let me know, you know, how we need to help. And then Yumiko, what do you think? Do you think the medical students might be able to work on this?
On the proposal to Mike Bloomberg specifically?
Well, to work on, you know, I think one of the most important areas that's most, as TJ already said, I mean, one is I think we got to get all the healthcare providers who don't vote.
Yeah.
Apparently they pointed out, Yumiko, and I'm not surprised, they're all too busy to vote.
Yeah.
Now, you know, with absentee ballot, there's absolutely no excuse for that.
Right. It's all about
but one of the problems is how we get the message out. It's very hard for us to get the message out. But another group that does not vote, there has a lower percentage turnout, is East Gainesville.
Yeah.
And they have a lot, I mean, Medicaid, expansion of Medicaid would impact East Gainesville tremendously. And we, you know, if we could get better access, and one of the things that I've realized, you know, having been to work virtually, is that actually telemedicine is a way we could reach a huge number of working class people who can't come to clinic from 9 to 5. They have to have an off hour, and you know, they can't necessarily get transportation, they can't park, everything is against them. But I think if they were to have Medicaid expansion, then telemedicine is a way to reach them on their time and with their convenience. And a lot of the illnesses that we're dealing with, diabetes, hypertension, really can be managed very well by telemedicine once you've seen them once. And I think, wouldn't that be great to improve their health, their overall health? And as you know, as we've talked about before, one of the reasons that it impacts the African American community, the Latino community, so much greater is they have more underlying chronic conditions that are out of control. And wouldn't it be great if we could get that control? One of the most important things is expand Medicaid. We can't expand Medicaid if we don't have legislators that are in favor of expanding Medicaid. So that's a key condition, and that everybody should be looking out for who they should vote for. But they can't vote if they aren't registered to vote, and if they don't go to the polling place or they don't get an absentee ballot. So you sort of have to take one step at a time. But I think that what I'm sensing is that East Gainesville would be a key target group if we could. Now, by the way, Yumiko, you have 2 African-American medical students, right, on your committee?
Yeah, that's correct. So I agree with everything you're saying, Dr. Southwick, and I think Alejandra's approach is definitely the right one about tapping into organizations. And so that's been our approach too. For Southwest Gainesville, we some of our med student organizations are partnering with SWAG. Dr. Harrell's partnering with SWAG to do a testing site there. And so we will offer voter registration materials during that. We're partnering with Peaceful Paths and offering voter registration during the Ask a Doc program. And then of course in clinics, because like you're saying, I think we have more access right now to communities than maybe other institutions do that traditionally promote voter registration. Like not everyone is going to the library right now, but people are still going to see their doctor, or at least seeing them through telemedicine. So we're definitely using all of those avenues. And then part of the reason we wanted to come on here is because we realized the resources we're using, they're really not just exclusive to like physicians, or there's nothing special about them that is specific to like health professionals. Like really any organization can use our resources, whether that's like a faith-based organization or Meridian, Alejandro just put in the chat. We reached out to a couple of people there. We haven't heard back, but definitely worth pushing for something there. And yeah, I agree. I mean, I got into this line of work, honestly, as an undergrad up in the Bronx. And at the time, clinic-led voter registration we were called like radical. And this is up in New York, you know, we were told that we were radical and crazy and politicizing medicine. And it's not about that. It's, you know, it's about empowering our communities, I think, having convenience and accessible voter registration. And we would approach patients in the waiting room, and we found that pretty much everyone that was eligible wanted to vote. They just had never been presented with the opportunity in a trusted space, right? In like a convenient space. And I think it was really special because you're empowering communities in a way that's not doctors going in saying, we know what's best for you. It's a way that, you know, to promote empowerment through patients and communities themselves. So yeah, we're here. Hit us up for resources. Anything we can do to help.
Right. And TJ, isn't another group, what's the percentage of registered voters in the university, in the undergraduate and graduate schools at University of Florida that vote? Do you have any idea what the percentage vote there is?
The Graham Center is tied to a report out of Tufts that tracks all the universities or all the participating universities. And I think in 2016, they were at like 68% turnout, which makes it one of the more engaged universities in Florida. So they do a pretty good job. And it actually breaks it down based on major. So I know in 2016, I think education majors were the most likely to vote and be registered to vote, whereas engineering students were the least likely to register and least likely to vote.
Now, Celine and John, are there any things you could do to encourage voter registration, making sure that they're not one of the 8 with the wrong address or other correction for registration, and to make sure? I would think, you know, I'm surprised you mentioned that undergraduate students and graduate students don't like mail-in ballot. If anybody, if they're oriented toward paper and writing, and I would think it would be a lot more convenient for them rather than spending the time waiting in a line to send in a paper ballot. I'm really shocked that that isn't more attractive to them. And I wonder if, John, you or Celine could comment on why you think this group doesn't use mail-in, and whether or not we could encourage mail-in.
I would just say it just seems like I already have my paperwork done to vote in person, and I know where to go. It's like 5 minutes from my house, so
okay,
it's so convenient for me that way. And
are they going to have
for me? There's no reason to do.
Right? Is there going to be a voting station at Rice Union this year? Oh, that's really good.
And I think for young people, the filling out the ballot part, it's the mail part. Young people don't engage with the mail or the physical mail.
Yeah, snail mail.
Yeah. And then on campus, if you're living in a dorm, your mail is very strange. You've got these mailboxes downstairs. Yeah.
And Dr. Austin asked about the NAACP and our partnerships or different partnerships with them. We work closely with the local NAACP. Evelyn Fox is the president. But I think it's really important, and I don't need to be the one to tell you all this, but the African American, the Black community isn't monolithic. There's very many different parts to it. So just because you're going to the churches, which is a wonderful way of conducting outreach among one part of the African American community, doesn't mean that you're connecting with other parts that don't engage in the same way. And simply by being a member of the NAACP, you are a more engaged individual. I think in many ways that voting is more of a byproduct of a higher level of engagement. You vote because you care about something. You don't vote just because you want the sticker or something like that, though I'm sure there are some who do that. But I think voting works a lot better for communities when it comes from engagement and it comes from an understanding of what different things or different candidates stand for one's community. So yeah, I think we don't ever. I make this mistake oftentimes with any group, and that's to think that if I talk to this one person, I'm good. I don't got to worry about it. But just like with the students, just like with every community, a lot of it comes down to one-on-one conversation and one-on-one understanding of different things, which is really hard and time-consuming work.
Which is where teachers and educators and the NAACP, so it isn't any one,
right?
It's a multiplicity of people and resources. Interestingly enough, and without a direct connection to our conversation today, I received a text message from a colleague who lives in the Tallahassee area, who asked if there is a way even to reach out to people who are actively involved in churches, who are members of the Black community, because he said one of the responses that they have heard in his efforts is something that sounds like, well, it's in God's hands. So that can be a place where the particular theology and a person's sense, particularly if they have already lived a life where maybe so often they have felt powerless, feel like they don't have a voice, then that is a way to make sense of the world, in which they live, because so much has felt as though it is not in their hands. And so I found that very interesting. And then I shared with Allie, and this is a name that you may recognize. Allie and I actually heard him in person about a year ago. I joined an online lecture by Dr. Ibram Kendi, who has written the book, How to Be an Anti-Racist. So it's like one of those books that's hard to find now. It's flying off the shelf. He spent some of his time in Gainesville when he was a student. In Gainesville, he was actively involved in one of those churches that Allie is making reference to, in one of our African-American congregations. And one of the things that he pointed out today is that the risk factor with respect to African Americans and people of color more generally being faced with higher rates of morbidity due to the coronavirus are related to everything that we've mentioned, but that they also have higher percentages living in areas where the quality of the water, the quality of the air, plants that may lead to, based on studies sometimes over many years, higher incidence of cancer and so forth, are also the places in which they have proximity. Now, that people don't always make the connection between voting and being able to effect change in communities in that way, but that is an important part of voting. And maybe it sounds on a given basis, on any given day, more like, if I elect this person, I personally will have a better job, or you know, the rhetoric or the framing in life will sound less bombastic or, you know, whatever personally, but communally, voting also can lead to the legislation which affects change really for an entire community and lift the entire community up to a standard where, you know, others should be. And so I just think people have become far too accustomed to settling for less because their experience has been that no matter what they aspire to, they have not received any more than, you know, sort of the crumbs of the American dream.
Yeah, Sharon, what you're describing is one of the key elements of power, apathy.
Mm-hmm. Mm-hmm.
Apathy is one of the single most important determinants of who goes out and votes and who becomes active. And I do think that the Black Lives Matter marches, I think, should have reduced that apathy greatly. And that's the hope. And I was very impressed in the TV interviews. Every organizer of Black Lives Matter said, vote.
Mm-hmm.
Vote was the key action that they were calling for. And if Black lives are to truly matter, the African-American community needs to get out there and vote. And that's how we're going to get the representatives that really feel that Black lives matter.
Right, exactly.
Yeah.
Exactly.
So Lynn, any thoughts on on UF students?
Yeah, so kind of coming off of what John said, I do agree with those points. Also, I think that, I mean, this whole meeting is about being informed, and I think that that's most important for young people, because this will be, I mean, kids in like their 20s, kids will be voting for, I mean, the first time in the general election. And a lot of people just don't really know how to go about this, especially during a pandemic. And I know during the year when times are obviously not like this, we do have people standing outside of the libraries and like the rights and everything, registering people to vote. But I think that now, since we kind of lost like that sense of human interaction, we don't really have a source of information for this. So I think that, I mean, that's kind of one of our main goals, just to get the word out. And I think that for young people, it's more important than ever, because obviously Florida is going to be a tough one. So
yeah, Yumiko has these great handouts and things you can email. I put on Facebook the various,
especially for students, you know, having like the
student Facebooks. I think we really need that. I think for a very compelling goal for the young is look at the California fires, look at the hurricanes. 3 hurricanes have hit the Gulf Coast in the last month. That's all global warming, and it's having a terrible impact. So that's another important, I think you've got to tailor to each voting group what's going to impact them the most.
Right.
And so I think that would be a great way to, and this is a very urgent time. We have no time left. Any other thoughts? It's actually 6:03. This is great. This is really terrific. TJ, Catherine, Yumiko, and Cynthia, great presentations. They're really very impressive. Any other questions?
I just want to say I'm in contact with a really good website, www.voteforward.org. And I'm just learning how to write letters. They will send me some names and addresses from the website that I can write to, and a way to do it. So I'm going to get started contacting voters, hopefully in the next couple of days.
Great. Can you send us that? Can you send me that website?
Yes.
You have my email? Yeah. Send me that, and I'm going to end. Let's see. Leanne is going to send me her.
Yeah, I'll send you my contact information.
Contact information. Good, good. And then I think we all, Nico has tremendous resources that we can use. Yes.
I just want to say, Sharon, thank you so much. You made a really great point. Yes, the Florida Conference does help us with our portion of the insurance. I have no problem with our Florida Conference. I am so proud to be associated with them. And that I'm not.
I was concerned. I thought, what?
No, don't, because each church decides how much they will contribute toward the that we pay for our insurance. And so I am so grateful that they helped me with that. I am scared to death. I'm going to lose my insurance, not through the fault of the United Methodist Church. I am proud to be part of the conference. And also thank you for some of the things you've said tonight, because I have really listened and learned a lot from you. So thank you.
Well, I
knows it all.
am very concerned about what you shared, and it's the anxiety and the fear that goes along with already trying to manage a disease. And I can't think of a disease in the world that is helped by anxiety and fear. Now, Dr. Southwood can jump in at any time, because I don't have a medical degree. But it seems to me
this has been our campaign prior to
is helped by that.
Our COVID-19. Our campaign was to try to get the reduction in the cost of insulin.
Yeah,
we have looked at this, and it is truly a life and death issue, and it's tragic. We actually held a wake with Father Allen, where we lit candles for at that time 7 young people that had died from rationing their insulin.
Mm-hmm.
So we know that 1/3 of ICU admissions for diabetic ketoacidosis are due to rationing of insulin. Then we know that this is, and 1 out of 4 diabetics admits when they go to clinic, there was a Yale study, admits they're rationing their insulin. And that means their hemoglobin A1C is up. That means they're going to get problems with their eyes, their kidneys, their heart, and their nerves.
Right.
Got it.
There have been times when I've had to make it last a week too, and thought, what am I going to do? I've got to cut the insulin down to make it at least manageable.
Well, it's just off the chart. My husband is diabetic.
It's wrong.
But his sister died in her 20s, did not live to raise her 2 children because she was a juvenile diabetic, and the family lost their insurance when my father-in-law died. And still had a couple of minor children. Like, she was diagnosed as a type 1 diabetic in the same month he died, and lost the insurance. And so diabetes is rampant kind of in his family. But whether type 1 or type 2, if you can't afford your medication, or for any other disease, if you can't afford your medication,
this is
it is a different life.
But insulin is the most clear cut. But there are many others. So I just wanted to go over our to-do list. Okay, Allie and Sharon are going to work on the churches. Is that right?
Yes, we're going to work on churches and Michael Bloomberg.
And Michael Bloomberg, and actually Ricky Ashby would like to help on that.
Oh, wonderful.
Okay. Ricky asked that he help on that. And then Celine and John are going to talk to Yumiko about getting the materials to the undergraduate students as well. And also, if those, I think a lot of these QR codes would be very helpful for the African American community too, because it makes it, we've got these really convenient websites. Bang, you just go in. And then Shirley, is there anything we need to do for the senior community?
Yeah, I think we need to see what Alice Premack has to say. She's got her hand up.
Okay, Alice, yes.
I wanted to ask how we could get those QR codes to send to our church or other organizations that we're in.
We should definitely do that. What we can do is we can send can we send that QR code to our whole mailing list? We could do that, right, Yumiko?
Yep, absolutely.
Okay, we will do this. Celine, we'll work on that, getting this out, and we'll have the whole video, but I think that the materials are going to be the key things, and getting those to the right people to make it easy. And the deadline for absentee voting's coming up soon, right? Early October.
Yeah.
Right. I do want to thank you, Fred. I think that you have made a tremendous change from our early conversation about being a non-voting organization. You've come a long way.
Apolitical. We didn't say non-voting, apolitical.
And working with the students has been a wonderful, wonderful experience. And
Yes.
now I'll just have to work on Mike Bloomberg.
Yes, we're going to work on Mike.
Lonnie, right.
And Shirley, thank you for dragging us along to be more engaged.
Yeah, Shirley keeps us going. She keeps us honest.
Without Shirley, where would we be?
Any last words? Any other thoughts? Any other questions?
Dr. Southwick, can you have my email address? Can you send me yours? Because I'm not sure that I have it.
Okay, I will, Ann. I'll write that down. That's my to-do list. I'll get your, I'll send you. Okay.
I have one final question for TJ, and it's about people wearing masks when they go out to vote early or on the day of election. Is your expectation they will, and how will you enforce it?
Our expectation is that they will wear a mask. If they do not have a mask, we will offer them a mask. But if it gets to the point where they say, no, I'm not going to wear a mask, we are not going to inhibit their right or ability to vote for not wearing one.
So you'll have a place aside you can take them to do voting that is...
Well, it'll all be socially distanced or physically distanced within the polling room, but we're not going to take them to any special Shirley space that you want us to know.
Okay, don't call us if you need help.
Disinfecting between.
That's actually, Shirley, that's actually an important point because the little booth or table where the non-mask wearer works to vote should be wiped down after they vote there.
Yeah, they're all wiped down after each use, regardless of
okay,
whether
good.
one is wearing a mask.
And
By
as
the
a
way,
worker, I can say it's involved in the training. Like they tell us during the training, like we have to do that. So it's standardized.
Lana, you can send me put your email right on the chat. It turns out you can copy and paste the chat. Can you send me, just put your email in the chat right now? And I'll put my email for Alice.
As soon as we hang up, I'll send it to you. That's
Okay,
easiest for me because I work through a phone.
Gotcha. Okay, sounds good.
If you can't be in touch with her, call me, okay?
Okay, it'll work out. It'll
I'll
be good.
connect you.
We all just need Shirley's Rolodex.
Yeah, Shirley has it all.
Listen,
Great. Thank you
we
very
work on Bloomberg, right?
Very exciting. As you see, there's a tremendous amount to do. The one other recommendation is I recommend, we all think about, we got to get all these people. Get 5 of your friends to vote and register. Just pick 5 people. Everybody in this meeting, pick 5 people. Think of how many people that would be. And what I found is personal people that you know personally, you have the most impact on. We're going to have trouble getting people we don't know, but people we do know, and you assume they're going to vote, but a lot of them don't. So get your friends. Reach out to your friends. Great. Well, thank you. This was fantastic. Thank everybody. Thank you.
Thank you.
Thank you. Bye.